Extras and Medicare Advantage plans give back flex cards, over the counter benefits, and hidden rules. Hi, everyone, and welcome to Medicare 360 Show. I'm your host, Jennifer Lee, where we help you understand Medicare so you can make confident healthcare decisions, not confusing ones. So, today we are going to talk about one of the most advertised and most misunderstood parts of Medicare, the extras inside your Medicare Advantage plans. You have probably seen so many commercials saying, get money back in your Social Security, free groceries, dental, vision, hearing included, flex cards worth hundreds of dollars. But today we're going to explain what these benefits really are, who qualifies and who doesn't, how they actually work behind the scenes, national rules versus Southern California differences, and the mistakes seniors make chasing extras. Because here's the truth, extras are helpful, but they should never be the reason you choose a plan solely. Unless maybe you're 100% healthy and you don't care about your health coverage. Okay, so let's take a quick refresher and talk about Medicare Advantage basics. So here's some context. Medicare Advantage, also called Part C, is an alternative way to receive Medicare benefits through private insurance companies approved by Centers for Medicare and Medicaid Services. Okay, CMS. CMS pays insurance companies a monthly amount to manage your care. The plan must cover hospital Part A, medical Part B, but companies compete by adding extra benefits. That's where givebacks, flex cards, and over-the-counter benefits come from, OTC. Okay, so let's go over Part B, Give Back explained. What is a give back? A Part B give back reduces your Medicare Part B premium. So let's take an example. If your standard Part B premium is $202.90, let's just say a plan can return $50, $100, $150, $200, sometimes more. Okay, so maybe not. Is it sometimes more? Well, depending on the area. Okay, so this appears as a higher Social Security deposit, so more money in your pocket. Okay, so how it actually works is the insurance company pays Medicare part of your premium on your behalf. You are not receiving cash. You are receiving a premium reduction. So, just to elaborate on this, let's just say you are receiving Social Security, right? You enter into a plan effective January 1st. That insurance company tells Social Security, Medicare that they are going to give you some money back. So the example of Part B premium of 202.90 minus say 150, right? What is that? I'm so bad at math. Okay, 202.90 minus, let's just say $150. Okay, so it's 52.90. So essentially, you're only paying $52.90 for your care. This is just an example because it will depend on your marketplace, your zip code, and your county. Okay, so that will result in more money back in your Social Security deposit every month. Let's just say you don't get Social Security and you are waiting till like you're 67 or 70. What will happen is when you are billed the monthly premium, sometimes people pay it quarterly, monthly, even yearly, they're going to deduct that, right? So like let's just say the first of the year you do pay the full, then that there's going to be some credit within that 90 days. So keep that in mind. Have had a lot of clients that their Medicare has been canceled because they forgot to pay their bill, their premium. So please pay that. Another thing to mention is if you're on Medi-Cal or Medicaid, you're not going to get an additional money premium back, right? Like, because if you're already on Medi-Cal or Medicaid full, you are already getting that free. I mean, they're already paying that premium for you. They're not going to give you more, right? So, not to burst someone's bubble, but some of Medi-Cal recipients think that's the case, and it is not. Okay, so keep that in mind. Um, you're not receiving that cash. So, who benefits most? Givebacks help people who are relatively healthy, use fewer specialists, want lower monthly costs. Okay. I think that this is big. In Southern California, the reality is in areas like Orange County, LA County, Inland Empire, competition between medical groups allow larger givebacks. Okay, so the trade-offs may include smaller doctor networks, IP assignment requirements, and referral systems. So that's the thing, right? You don't get something for nothing. Meaning, you got to really do some plan comparisons. While a plan may give you the largest give back, you got to look at, how much hospitalization is. You got to look at the medical group, the doctors in the network, right? The hospitals, because it may not work for you. And just because your particular insurance company takes your medical group and your doctor, they might not particularly take that plan. So keep that in mind as well. Okay. So the biggest thing is like, yeah, you're going to have a smaller network, but they love the money. They want the money. They're like, I'm healthy. I don't think I'm going to go to the hospital. And there are some that might be at zero cost per hospital. So you got to just do that comparison to make sure you are well aware of the costs involved of getting money back. Okay. So now let's talk about flex cards, right? So this is like a most understood benefit, I would say. Let's talk about the famous flex card because I'm sure you're getting a lot of mail and advertisements that you see all the time on this. So this is where confusion happens. A flex card is a prepaid debit style benefit used only for approved expenses. Okay. So not cash. You can't withdraw it. It's not anything you could spend on, right? So the most common flex categories, and this is going to depend on the plan that you're on and what they deemed. Dental services, vision expenses, hearing aids, utilities assistance, like, your cell phone bill or your gas, electric bill, your groceries, transportation, over the counter items. Okay, so those are the most common. I'm not saying it's the end all be all, but those are the most common. Important rule is flex benefits are conditional and not guaranteed spending money for you. Okay. Many require chronic condition qualification, and that's the big one. There's more audits on that. It's just previous years, it was very easy to get some of these benefits, and now they're really making sure you qualify for it. Are you financially eligible? Because there's some plans that give more based on your income if you're on Medi-Cal or Medicaid, and the Medi-Cal verifications on that. So let's just say a client sees an ad for $2,000 in Flex Card. The reality could be $500 in dental, $250 in vision, $750 in groceries, but only if a chronic condition is verified. And then like the remaining unused points or flex card expires, right? So kind of depends. Every plan is different. So it is wise to talk to a licensed agent like me so I could go over those details because most common is clients tell me, Jennifer, I saw a $5,000 flex card. And really, from what I've seen, there's not really any plans that give 5,000, right? But you got to look at it because sometimes it's on top of that particular coverage you have. Like, let's just say eyeglasses, you already get 250, but they're going to give you an additional for your eyeglasses, like over the amount. There are times where it's not like that. Like most plans do have, let's say, gym membership, but some plans are like, oh, you have to use your flex card for gym membership. So it kind of defeats the purpose on that. So keep that in mind. It is like a debit card, like a Visa or MasterCard. And then it depends also on the vendors because just recently, one, you go to Costco with it, right? Everyone loves Costco. So that's a good one. So there's CVS, Walgreens, but sometimes it's very particular to where you have to go or online. So keep that in mind. Okay. So something that does tie into that are OTC or over-the-counter benefits. So OTC benefits are among the most useful when used correctly. So what is OTC? It is a quarterly or monthly allowance to order vitamins, pain relievers, first aid supplies, diabetic supplies, cold medicine, toothpaste, toothbrush, things like that. Okay. Sometimes I've seen lotions on there, which is pretty neat. Sometimes they have food on there, which is cool. So the typical allowances, national averages maybe $25 to $100 per quarter. Some plans are monthly, and unused funds sometimes roll over and sometimes do not. So it just kind of depends on the plan you're on. And if you do have like a chronic condition, sometimes you definitely get more. Or if you're a dual, which is like you're on Medicare and Medi-Cal, you definitely get more as well. Things to note, usually you cannot buy alcohol. Sometimes you cannot buy like cookies or donuts because they deem that not healthy. So it kind of just depends on the plan. Some clients complain about the vendors, right? Like, hey, Walgreens is more expensive than CVS, or CVS is just more expensive than Costco or the supermarket. So things like that. And sometimes, oh, things are sold out, right? So getting it done earlier on the month could help. There's thermometers, there's these electric toothbrushes. There's just a lot, like Vaseline. There's a lot you could get. Sometimes people tell me it's too much. I can't spend all that much, right? But hey, maybe give it away to charity. I mean, it is there to use. Okay. So, just the biggest thing on that is make sure, like, if your over the counter does expire, use it monthly. If expires at the end of the year, use it by the end of the year. But towards the end of the year, things may be just more sold out, right? So just keep that in mind. I would set a reminder, do it every quarter or monthly for you, like a prescription refill. Hey, let's talk about dental, vision, and hearing extras. So these are most advertised extras as well. So let's clarify expectations. So dental and Medicare Advantage plans often include cleanings, x-rays, exams, major work, often limited. Typical annual max would be like say 1,000, 3,000. Implants and crowns may have waiting periods, co-insurance, network restrictions, or may not even be covered at all, right? So dentist participation, there are issues on that depending on the vendor, right? There's different vendors out there. So depending on the vendor used, and then if it's PPO, if it's HMO, if it's reimbursement. So dentists may accept the PPO patients, reject planned payment levels, balance billing, And this could really surprise you, the senior, but we are really here to help you. Dental does become tricky sometimes because there are like those fine details that are not covered, and we could help you with just the schedule of fees. I just highly advise, if you do see a new dentist or just see your dentist in general, before you do any work, I would make sure that your insurance covers it, that you're getting an itemized bill, you know what you're going in there for before like getting a bill and then like, oh my gosh, it's thousands of dollars that you didn't even know wasn't covered, or they're just charging you like an arm and a leg for it. So please definitely keep that in mind. Okay, so let's go over vision. So it usually includes an eye exam, a glass allowance. So things that are like an eye disease treatment, like glaucoma or something like that, that remains under Medicare Part B, okay? This is just for like the optometrist, but the ophthalmologist is Part B. So this sometimes like you only could go to an in-network provider. Sometimes if you go to a preferred provider, um, it's more you get more like bang for your buck. So I would definitely do that. Okay. So hearing is another one. It could Most plans do include the hearing exam because whatever original Medicare covers, it needs to be covered. And then there's like an allowance toward hearing aids. But like if it's premium, like higher, like tech quality, and exceeds a limit, you definitely have to pay for it, or you have to pay a copay for your hearing aids and so forth. And then the vendors are all different as well. Okay. So let us go over special supplemental benefits, SSBCI. Um, these are newer benefits CMS allows for chronic conditions. Okay, so example, grocery cards, right, for those with the chronic conditions, home air filters, humidifiers, pest control, meal delivery, transportation, right? And a lot of plans do offer transportation, but sometimes it's limited. Sometimes if you have a chronic condition, it's like unlimited. Some like give back plans may not even have transportation, right? Because they're giving you money. So why are they going to give you all these extra benefits? So keep that in mind. So the qualifications typically for these special supplemental benefits must be diagnosed with diabetes, heart condition, COPD, chronic heart failure. Okay, and these plans are verified through claims history, right? Something that's public, doctor records, health assessments. Okay, so not every member receives these automatically. Eligibility must be validated. So it's definitely a shocker if in previous years you did get this and now it needs to be verified chronically, verified on it. Sometimes, people will lose that benefit, so then they are really upset with their plans. Okay, so what else should we talk about today? Okay, so yeah, not every member receive these automatically now. Okay. So in Southern California, we definitely operate in IPAs, the Independent Physician Associations. They coordinate care and manage costs locally, right? So nationally, doctor control is like carrier driven. Southern California is IPA driven. Referrals are very common in Southern California, nationally sometimes. Networks in Southern California are medical group based. Nationally, it's just more broad. And in Southern California, IPA coordination impacts access, while nationally it's more like plan rules. But every area is going to be different, so keep that in mind. So your experience really depends heavily on your medical group you're assigned to or that you pick, not just the insurance company. So definitely keep that in mind, right? Clients, they move out of California thinking that the plans are going to be as similar, but they're not, right? So if you do move out, I would definitely, as you get older, go to an area where they have good care, good hospitals, good medical systems, right? Because if you do have ailments and you're rather sick, it's better to go to high quality hospitals and medical group and doctors versus maybe like in the rural area where you have to find a doctor 50 miles away or a specialist. That is crazy. And the coverages might not be as good as in Southern California, which we have really low maximum out of pockets, very few out of pocket costs, and then just really great medical groups in Southern California. Okay. So I would say the biggest truths for all these extra benefits or extras or bonuses, right? They're not healthcare foundations. I would just say in the past 5 years, advertising so heavy in regards to these benefits, right? That we lose sight of maybe the medical groups and the doctor that you're with. And now that they're kind of pushing back, decreasing benefits because healthcare is getting costlier with the Inflation Reduction Act and so forth. Seniors are so used to these benefits, and I get it, but then now as things are tightening up, lesser benefits, but that doesn't mean lesser quality care. Just keep that in mind. Doctor access does really matter more than the flex card. So that's the biggest thing, right? Some clients, they definitely want to check the plans every single year to make sure they have the most benefits, which by all means, I will help and make sure you have the most benefits year round every year. However, there's just some clients that want stability. They don't want to change every single year and back and forth, right? If you're savvy, you just want all those value based benefits, yeah, definitely. But if you don't, you just want stability, right? So the best plan does balance like your providers, your medication coverage, the costs, and the extras. So like I kind of take it in where like my doctors come first and then hey, this is what I need for this year, how is it, and then just compare the plans on there, right? So questions every senior should ask before enrolling is, are my doctors in network? Okay, the thing we can't change is if your doctor decides to not get a contract or doesn't qualify for a contract, and that's something we can't change. What medical group am I assigned to? Sometimes doctors are assigned to several medical groups, and you want to make sure you want to be the one that aligns to your specialist or to the hospital that you want to go to. Okay, and like, how do I qualify for these extras? Like, do I just get them? Do I have to do something? And keep in mind, I actually didn't even go over like these extra things you could do. Like if you do preventive care, if you see a doctor within this time frame, you go to the gym, like you get extra points or bonuses or money for that. I didn't talk about this time, but there are plans like that, or even get money to get a caregiver, which is pretty neat. So what expires, right? So which benefits expire and when? Because you definitely want to make sure that you know when to use your benefits and if you're going to keep them. And who helps me use the benefits? Like we're here to help you with that. So if you'd like help reviewing your Medicare options or understanding your plan benefits, reach out to us, our team at Premier 360 Insurance and Financial Solutions. We believe education comes first, enrollment second. I'm Jennifer Alfonso Ly, and this has been the Medicare 360 show. Stay informed, stay empowered, and we will see you next time. You have a wonderful day.